Hi everyone, my name is Eva Zilhuis, and today I'm joined by Professor Rukshana Shroff. She's Professor of Paediatric Nephrology at UCL Great Ormond Street Hospital, and we're going to talk about her role in kidney care. Thank you, Rukshana, for joining me for this podcast for the RPSG Education Biobank.
My pleasure. Thank you for inviting me. Thank you.
Great. Let's start with the first question. Please tell us, who are you and what is your background?
Okay. Hi, everyone. I'm Rukshana Shroff. I'm a professor of pediatric nephrology at Great Ormond Street Hospital and the UCL Institute of Child Health. I am a full-time clinician, but also an avid researcher and an educator, and I absolutely love all three roles. So my main work is with children with severe kidney failure, chronic kidney disease, and on dialysis, and my research focuses in this field.
So you touched on what your main job entails, but please could you describe that a little bit more?
Thank you. So children with severe kidney failure should ideally have a kidney transplant as the first choice of treatment. This is sadly not possible in every case, and some children don't have a kidney donor within their close family or friends, and therefore they need dialysis as a bridge to transplantation. My work is to look after these children with severe kidney failure and also to prepare them for transplantation, as well as, very importantly, to look after children on dialysis. So dialysis is always considered a bridge to transplantation. We do three different types of dialysis: the tummy dialysis, as in peritoneal dialysis; hemodialysis, which is the blood dialysis, which is performed either in center or at home. And then there are specific nuances to the dialysis modalities as well. Dialysis gives a child back about 15 to 20% of what normal kidney function should be. So children with severe kidney failure and those on dialysis will have multiple complications, including with their bones, their cardiovascular health, anemia, acidosis, poor growth, and also a reduced quality of life. They also have multiple restrictions in terms of their diet and how much fluids they can have. And of course, the caregiver burden and the pressure on the family cannot be underestimated. There are sadly very few research studies in children on dialysis, and when we compare this with the adult field, it is a very big void and an area we really need to pick up on. Secondly, the dialysis machines we have and the dialysis technology is mainly designed for adults, and the adaptation of this for children is lacking in many cases, and this is an area of advocacy and work with industry that is extremely important.
Thank you. So what is your role in the kidney care?
I look after these children with kidney failure and on dialysis. We see them in regular clinics. It can be as often as once a week or several times a month. Once they are very stable, we can even see them every month. I look after the children on in-center hemodialysis, and sadly, many of these children will have frequent hospital admissions where I'm involved. I'm also involved in teaching healthcare professionals about how best to manage children with kidney failure and on dialysis. And in my new role as the president of the International Paediatric Nephrology Association, my roles with education and advocacy are very predominant.
Thank you. What is the latest research in your field?
There's lots of different research studies. Perhaps if I give you an example of two studies I'm involved in. A few years ago, I set up the hemodiafiltration for children, and we did a study across Europe and actually Canada as well to look at the benefits of hemodiafiltration versus standard hemodialysis, and showed the benefits of hemodiafiltration. So this is a small adaptation to a dialysis, the hemodialysis technique, which gives a far better clearance of the toxins in kidney failure, and it helps the children in terms of improved cardiovascular health, growth, and also their quality of life. They feel more energetic, they have a better school attendance, better physical activity, better appetite, improved growth, so multiple advantages. So this is one area of research, and we are continuing this field of research, looking at trying to refine and improve the hemodiafiltration in different ways. This is one area of work. A second area is to work with children on peritoneal dialysis, and to see the benefits of one of the peritoneal dialysis fluids called icodextrin, and to see how it can improve fluid removal, blood pressure control, and therefore also improving the longevity of the peritoneal dialysis technique for these patients. So these are just two small examples of where I'm involved, but there are other studies predominantly focusing on acute kidney injury as well and improving dialysis techniques for this.
Wow, that sounds good. It sounds promising that the care for these children will be improved. My next question is, what advances do you think will be there in the kidney care in the next 5 years?
In the next 5 years, or perhaps a little bit longer than that, I hope there'll be huge improvements in transplantation, and therefore the availability of kidneys for children and adults on dialysis will be accelerated, reducing the time these children need with dialysis. I also hope that dialysis technology improves, particularly for our youngest patients, where really we need a lot more commitment and interest from industry to work on improving technology for very young children.
Thank you. What advances would you like to see in kidney care?
Exactly these 2 points I've mentioned. In an absolutely perfect world, no child or adult should need long-term dialysis, and kidney availability should be much improved, with improved medications, and even in the field of xenotransplantation. Of course, one can also talk about prevention of CKD progression. There are a large number of studies now, mainly in adults, and we're trying to catch up on this in pediatrics to attenuate or slow down the progression of kidney failure, so that the time to needing dialysis and therefore the time hopefully on dialysis can both be controlled in a very good way.
Wow, thank you. Thank you for your time, Rukshana. It was very fascinating to hear about your role in kidney care. Do you have any final thoughts before we close?
No, thank you for your good work, and I hope we get lots of support from our stakeholders, our children and their families, as well as from industry and kidney charities. It's important that we highlight the importance of kidney problems in our patients and really try and come together as one to improve the care for these patients. Thank you.
Thank you again, Rukshana, and thank you, dear listener, for joining us for this interview. We hope this conversation was insightful into the world of kidney care, and stay tuned for more interviews with other professionals involved in kidney research. See you in the next episode.